How do I learn medical copywriting? Also, how fast can I start making money? I learned copywriting off Hustlers University, but it was very saturated and frustrating. So I would say that if you're going to learn any type of copywriting, then you need to specialize, and medical copywriting is a great place to specialize in because it's very particular, and I would say it is a specialist skill. So you need to know how to research and find accurate information that is evidence-based, that people can trust, and that you know how to write in different ways for different audiences. So maybe for patients, or maybe for healthcare professionals, or maybe for academics, or maybe for a health authority, like a regulatory authority. So if you're writing clinical trials or journal articles, or even for an educational institute like a university. So if you are thinking about how fast you can start making money, it depends on how fast you can learn the skills to be a medical copywriter. So you do need to learn how to reference properly, how to research properly, and also how to write with a really good structure. And as a copywriter, you'll need to know how to write with a really good structure anyway. And I'm talking about knowing the differences between like a H1, a H2, and a H3 heading, and also how to write in a convincing way. And then there are little tips and tricks like making sure that you use bullet points, or making sure that you give people a set of 3 things to remember, because more than 3 things tend to be forgotten. And in terms of how fast, just like the second part of that, I would say that it's important to keep in mind that your first job is not going to be a lot of money. So you're going to have to build your portfolio in the same way as you would for any creative person, whether you're a copywriter or an artist or a music producer, for example. So I would recommend that you try to find some jobs and do a really good job as a copywriter, and then get a testimonial or some kind of recommendation in writing from that client, and then use that to charge a little bit more for your next client. And that's how you end up charging lots of money, because you end up building such a big portfolio that proves you are a good writer and that you get results for people. And that's the most important thing. If you're a writer, you need to make sure that your writing actually does what you want it to do. So this could be including a call to action like click here to buy this book, or click here to book an appointment, or click here to make a donation if you're writing for a charity, for example. So if you do not have any clients, then I would say volunteer your skills maybe to a charity or a non-governmental organization or a non-profit, and try to get a testimonial from them. So then when you do good work for them, even though it was free, you've got the testimonial, which is the more valuable thing. And then you can use that to go and charge someone to make money with your first piece of writing. So you can find clients, potential clients, from places like, Juno is like a freelancer marketplace. They tend to have bigger clients, but you'll need to have more of a portfolio if you go there. Or you could also try Upwork. So that's where I started. And then I would say for anyone, you can try on LinkedIn, but you have to be quite careful, because there are really good, very kind of lucrative opportunities on LinkedIn. And also, if you network with other copywriters, maybe they have some jobs that they could give you. Maybe they have too much work. So how quickly you make money is how quickly you network, how quickly you can produce good work. And I would say try not to rush as well, because you might want to make money fast, but I think you will lack the quality and the depth of work that you need to do as a writer. So make sure you do a good job. That's your priority, especially if it's health or medical information. At the end of the day, a patient is going to be at the end of the line. So make sure that you are keeping that in mind, and good luck.